All right, so let's get started with our ACJ orientation session. And I'll be just sharing my screen. Okay. All right. I'll put your chats here just in case. All right, let's get started with this part. So first, we are going to talk a little bit about what the ACJ exam is. And then I want to get to the fun part, and then we'll continue talking about some things about the ACJ itself. So first, the ACJ format. Okay. So we have a question: is this for ACJ or situational? This is ACJ. The situational is happening. It's in the other. It's happening in another link. So in the other room. So if you are you looking for ACJ or situational? Okay, let me send you the link for that because you're in the wrong. I'm not sure how you signed up for the wrong event, but well, let me just send you the link. Okay, and please don't go there because you'll be all over the place if you are still in ACJ. You'll have your time for situational. So this is for the situational. Okay. So just hop in there, doctor, and we have to start the. So this is for ACJ. Anyone in the wrong room? Hopefully everybody got into the right. So copy, you'll have to click on it maybe, then get out of this and go into that one. Okay. All right. So let's get back. ACJ format. Okay. There. The ACJ format. So the ACJ is almost a 5.5-hour exam. Okay. With one scheduled 30-minute break. So total could be like 6. Okay. You have 120 to 100 in, scheduled 30 breaks. So it's 5 plus the break. Okay. Now, I think we have another. Let me clear these out a bit because I think some people are joining the wrong session. Okay, so this is for ACJ. Dolores, do you want me to send you the link for the situational? I think you do. Let me give you a second. There's some confusion with some of these students. Apologies for this. Okay, I sent it to you, Dolores. Okay. Interesting mistake, but yeah. Okay, so let's begin from the start. So you have a 5.5-hour exam with a 30-minute break. You may get 120 to 150 questions. Now, recently it's been more toward 150. Okay, so expect 150 questions. They could be single answer or multi-answer. What does that mean? So they might tell you select only one, or they may say select one or more. So if they say select one, then you only choose one, obviously. And if you're doing it on a computer, you could only select one anyway. They won't let you select another one. But if it says select one or more, it doesn't mean it has to be more than one. It could be one or more. Okay, so that's up to you to decide. It's usually now, electronic on computers. Okay, and of course, you'd want to go through the detailed protocol. They'll send it to you once you register, and whatever protocol you have to follow once you register. Also give that a read. Now, what we want to tend to follow is if you go to resources on the website, you'll see under ACJ question and answer framework, and then you'll see ACJ question and answer framework. You want to download that. There might be an update every once in a while. So you update this, you download that, and that's the templates. That's what the questions that come. Okay, and we'll talk about that a bit later if you're new to this. Okay, so you want to download that and see what it's kind of like the release questions, but for ACJ. Okay, so download that template from their website. Okay, from the NDEB website. So what are these 150 questions? What do they cover? What do you have to study? Okay, so there's going to be, and the reason I switched it now like this is because radiology has a more weight now than before. So you have diagnosis, treatment planning, and clinical decision making. That's one part of the exam, and this could include, for example, pathology, diagnosis, and treatment, ortho, diagnosis, and treatment, perio, diagnosis, and treatment, endo, diagnosis. There's no real endo treatment template, but we'll teach you still the treatments so that in case they bring things. Okay, there's patient management, like what do you do in certain situations. There's like an investigation template, so we kind of give each template a nickname. Okay, so the investigation template is like, what kind of exams would you do to figure out the diagnosis, right? So all of this is under diagnosis, treatment planning, and clinical decision making. There isn't really any prosto treatment planning. Okay, so they don't go into that. There isn't any restorative treatment planning as much, except for what's in the radiology. Okay, now in the radiographic interpretation, okay, that part, the graphic interpretation, that's actually now being a little bit more than what you may think. So a lot of reports have been, you're getting almost 100 questions from the radiology. You're getting 100 x-rays and maybe 50 questions in this part, so expect something like that. So the radiology is very important, and that's why we're going to be really heavy focused on radiology. And again, both of these could be select one or select one or more. Now, if you look at the website, you see the blueprint says something like this. Oh, pharma. Also, we said pharma is part of it as well. Okay, so pharma, you got oral medicine, pathology, surgery, perio, endo, all of this, 100%. So you might be like, wait a minute, this is why you can't rely on these blueprints all the time. Where's the radiology? Well, why is there? Sorry, this is not working here. All right, interesting. This works. Oh, it's just this one. Okay. So why is there no radiology here? Well, because radiology could be interpreted as many things, right? So for example, most of your treatment planning and diagnosis happens through radiology, right? A lot of times. So let's say you have a radiograph about when you do caries treatment, when you do restorations, diagnosing caries. They might consider that as cariology and restorative, right? What if you have an X-ray about diagnosing pathology? So that may be pathology. But to us, when we're studying, we look at that as what? We look at that as radiology, because we're learning it through radiology. I'm just having some. Okay, there you go. All right, so this is kind of the blueprint, but the blueprint itself doesn't reflect how you're studying. Because if you go study cariology, you might end up studying a lot of, textbook caries and restorative dentistry. You go study class 2 preparation and composites, and it's not really that. It's actually checking it out on a radiograph. So really you have to study the radiograph. So that's why if you go on your own and you look at this blueprint, you might misinterpret what that really means. Okay, so we're here to guide you on what you really need from that, which is really a lot of radiology. Okay. All right, so now the exciting part, how to use our online portal, and then we could go to some examples. Okay, so this is the part that's going to be new. Everything else is kind of already recorded in a video, but this is the part that's going to be a bit different. Okay, so I'm going to now stop sharing, and then I'm going to share how the platform will look. Okay. So I'm going to start from the beginning, so that's not and then I'll also discuss the plan. So this, once you are registering and we send you that initial email, you'll be asked to change your password or add a password to your account. So you're given a link, you go through that link, your username is there, and then you put a password. Okay, your email and your password. Now, once you do the password, it'll take you through, okay, welcome, click on the course, and you get to this page. Okay, and another way to get to this is through the website as well, by going to ACJ Online. But anyway, this is how the new platform on the website is for the course delivery. Okay, so you could see here, and if we find this all smooth and great, we'll be transferring it to all the other courses as well. Okay, so just to give it a initial testing first. Okay, but so far it's been awesome. Okay, so the way it works is you'll be given access to this. Here are all your modules. You can see here on the left. So introduction, module 1, templates part 1, which is going to open February 6th. That's on Monday. Then you have module 2, which opens February 13, right? On the week after, and the week after, all the way to the end. Okay. So you get access to this, and here's our first, if you click on introduction module, you'll see all the things underneath introduction module. Okay, so I could refresh this just because I think I took that one part out. Okay, there. Now, so this also, if you open this on your phone, it works now, right? This part of the platform works, and it's pretty smooth. So we have a welcome message. This is reading material. Okay, so just read the welcoming message. Okay, what's next? It says a check mark that you're done. Okay, let's look at the course structure. Okay, to understand how we are organizing the course. Okay, so how does the course work? What's our plan? So our plan is about first watching the videos. So the watching the videos part, the lectures, is something you want to do during the week before you're live, ideally. So usually you have from Monday to Friday to go through the videos, watch the main part of the video, and then Saturday and Sunday you have a live session. Now you could continue watching them later, but it's ideal because there might be a discussion about those videos during the live session. Okay, it keeps showing me this thing that I could highlight, but I don't need to highlight. So to finish the video, so you are ready for the live session. If you cannot do that, do not worry. You could still watch them on Saturday and Sunday. No big deal, but it's better if you could do it. We want to push you to do the right thing, which is try to finish them before Saturday. Okay. So the first part of the videos are going to be template discussion videos. Okay. So our template discussion videos, template discussion. Remember I told you you're going to download the ACJ templates. So we're going to go through all the templates in the ACJ framework and discuss each option. When is it best to answer? Okay. So if you go to the NDEB, let's see, NDEB, resources, how to prepare, you can see here, okay, ACJ, still the same framework. You click on it, you could download this, and you see this. This is a template, okay? Let's take an easy template so it's not too confusing. For example, this one, okay? In addition to periodontal probing and palpation, which of the following are indicated to establish a diagnosis for the patient? So what's this template concept? We call it the investigation. What investigations will you do to diagnose the case? Now, the case will change. Whatever the case is, that will change, but they will most likely just bring this template, right? And then you could answer more than one or whatever answers that make sense for that question, okay? Does everyone understand what the template means and how it works? Is there any questions about this? So when we go through the initial 2 weeks, it's getting you familiar with the templates, that you know each option in each template, how to answer them, how to, what kind of answers are more common. When, for example, if you look at the pathology template, it's select one, which of the following is the most likely diagnosis. So we need to learn, when do we diagnose linea alba? When do we diagnose Fordyce? When do we diagnose, okay? So let me know if there's anyone that's still confused about the idea. Okay, so if you're good there, now, of course, these templates, there could be some curveballs, they could change things, they could mix things up in the exam. So we will be, going through different experiences in the course. Okay, so let's go back to our platform. So now we covered the template video. That's going to be the first 2 weeks, module 1. You can see here, module 1, templates part 1, and module 2, templates part 2. Okay. Now, the book, it's ideal to read along with the videos. So you have the book. Now, how is the book made? The book is made in a similar way, where we have a template. Then each option in the template has a paragraph underneath to say, when is it ideally chosen? It's more of a handbook, more of a manual, an interactive manual. It's not a textbook, okay? It's not going to give you everything you need to know about lichen planus, like a Neville. It's not going to give you everything you need to know about, a specific disease, like a Neville. It's not a theory book. It's a practical ACJ manual, okay? So the book, the way it looks, it'll be each of these options will be displayed, and underneath it will say, this is when it's ideally to be chosen. You could also choose it in these cases, and it'll talk about when to choose that, giving you an example, a photo example, for example, a photo for that lesion, for example, in pathology, and just other concepts about that template, like, okay, when should you choose this and when should you choose that? So it's a guide manual, and you could actually, for each disease, we have a template beside it, and I'll teach you guys during the course how to do that. But for each disease, you have the entire template beside it, so that you kind of know how to choose the treatment template. So there's also where's that treatment template? I think it's at the end of pathology. All right, here maybe. So here you can see this is a treatment template for pathology, right? So we'll put one of these beside each pathology so that you could select on it, and that way it's easier to memorize, right, and study. So that's what the book is. Now, you should, some things in the book are broad. What does that mean? Like, if you look in textbooks, there could be a treatment where it's broad. They mention a lot of things. For example, a common one is pemphigus. You go to pemphigus in textbook, it's like, oh, choose steroid, or you could do topical steroid, you could do systemic steroid. Also, you could do antibiotics to prevent secondary infection. So there's a broad thing sometimes, but then there is a narrow thing that we will do as a best practice in ACJ. So for example, we'll tell you in ACJ, just choose systemic, that's it. Don't risk choosing something else. So in the book, keep it, if you have it with you, you might have to kind of add some notes, maybe even make some updates in the book with the videos, okay? Now, once you're done the initial 2 weeks with the textbook, okay, you kind of have everything, you went through that, you learned the template. So you can see here on the left, you have the 2 weeks, right? Okay, now after that, we're going to start practicing. That's where the magic begins. You have to start practicing. That's where you learn, okay? So module 3, we have 4 cases a week plus 1 radio practice, which is 100 x-rays, okay? So you will have to, and the way these are given to you is through another platform, okay, which is an examination platform. And it'll negative mark you if you do it wrong, and it'll compare you also to your peers. So you'll see your rank, you'll see if you're number 1 or if you're number 5, or what's your percentile that time. So it's pretty awesome that way. It's almost like having a mock every week. Think of it like that. You have 4 cases and 100 x-rays. Okay. So module 3 we'll start with case 1 to 4 and then a radio practice 1. So when you do that, I don't like how this keeps popping up, but let's just say, okay. Now, when you do that, during that week, when you're done, you should watch the case discussion videos. So we do have videos that will discuss each case. So case 1 discussion, case 2 discussion, case 3 discussion, then radio practice 1 discussion. Okay. So these case solutions are recorded in a video, and there's also some interaction there. You can see me going back and forth with students. Okay. If they are not recorded, we'll do it during the live anyway. But if they are recorded, watch them so you get kind of knowing where it may solve a lot of issues for you on your own time, flexibly. Then you come to the live session. So now you've done your homework during the week. Okay, what did you do? You watch the whatever videos you were supposed to watch, whether that's so let's say the first 2 weeks you're done. You watch your template videos. Okay. Okay, easy. Yeah, thank you. Okay, so let's say during the first week, sorry about that, just a little. Yeah, so the first 2 weeks, you watch your template videos, you work with your book, you came to the live session, because every week you have a live session. In the live session, for the first 2 weeks, we will talk about the templates again. We will say, okay, what do you guys think? Any questions about the templates? Okay, so on the Saturday, we'll talk about the templates. It's called a template Q&A. We're going to go over those templates that you talked, or if you have any doubts about something or questions, we'll talk about them. Okay. And on the Sunday, you might be actually exposed to new things with the instructor. So there'll be instructors that have a live session that will present new concepts even that are out of those videos. Okay. So so is that clear to everybody so far? So we talked about the first 2 weeks, templates, discussion videos, go through the book. Then there's a live session every week. There's live sessions. Okay. So the live session just makes sense with whatever you did that week. So if it was a template week, then you're going to discuss that. There will be some additional ones on Sunday that will have kind of like a different, how do you say, like it won't be template discussion. It will be something that will catch you on the spot. Hey, here's a new concept. Here's an x-ray. What do you think? So just something like that. Okay. All right. So we're done with template videos, booked videos. Now, I just repeated the first 2 weeks because of the live sessions. Okay. Now, when you get to module 3, what do you do during the week? You're solving the cases. You're solving the radio practice. Okay. Then you watch their videos. Okay. Then you come again to the live. On Saturday, we'll have a Q&A about those cases and radiology. So let's say you're not convinced. You're like, wait a minute, I chose this. You guys chose this. I'm not convinced. I want to know why. What do you guys think? So you'll be doing this with also with one of the instructors. And we'll discuss what options we have here, right? Like if there is one that could be, there's leeway. It's a judgment exam, which means there is some flexibility depending on your judgment, okay? So there's always going to be a Saturday, Sunday, pretty much, okay? So we keep doing that. So module 4, 5, you have cases 5 to 8, 5, 6, 7, 8, radio practice 2 and 3, still 100 x-rays. Module 5, cases 9 to 12. So 9, 10, 11, 12, radio practice 4, 100 x-rays. Then module 6 is the ortho. You can call it the ortho cases. So we're done with the clinical cases. There'll be 10 cases here to apply the templates on. You solve them. Then you have radio practice 5 and 6, which is another 100 x-rays. Okay. Then module 7 is when mock 1 starts. Okay. Mock 1, but because we don't have so much time, we had to put the radio patho practice in module 7, which is a mix of radiology and pathology photos now, and answering them. But also you have a mock. So we'll be discussing those on the weekend. Then after that, you have mock 2, mock 3, mock 4, and we're adding a mock 5 as well. Okay. Now, from our experience, people that did well in the mocks, well meaning for now above 75, 57% of them passed. But that's based on, there's something that we are going to do new now that we figured out that we're going to improve those. Okay. And then you have the last week here before the exam where there's some study notes. So what's one of the new things that we're going to add other than the platform, of course, and the mock 5? Okay. So we said the live sessions are Saturday, which focuses on the weekly videos or cases, whatever we did that week. The Saturday focuses on discussing what happened that week. Okay. The Sunday is sometimes something new. Okay. It's going to be a new lecture. You haven't seen necessarily this before. It's just something that, okay, well, you guys, let's talk more about perio. Let's do a little bit more perio. And the cool thing is they will be recorded. So for example, the Sunday will be recorded because it's new. So you'll be able to watch it. And we are going to add something new. It's a new live. We're deciding what date to fit it in. It may be on Saturday as well. So you might have from, let's say, 9:30 to 12:30 this session. And then from, let's say, 1:30 or 2 to, let's say, 5, you have a new live session. What is this new live session? Okay. This new live session will be basically, so when we interviewed a lot of people that passed, we thought, what did you guys do differently? Like these people took the course, these people took the course. What did you do differently to pass? They said they read a lot of textbooks on their own. Okay. That was one of the things. So we figured out which textbooks. And also, we're going to walk you through those textbooks and how to do it. Okay. So it's going to save you a lot of, needing to do it on your own. So if you feel like you're not motivated to go open a textbook and do it, we're going to walk you through it. Okay. And these sessions will also be recorded. Okay. So what we're going to do, not everything will be recorded. So for example, this part may not be recorded. Okay. This part may not be recorded, but you already have the recording for it. But you can't if you keep recording forever, then you keep having this infinite loop of recordings, right? That are recording the same thing. So I already have a discussion recorded for this, for the cases. You don't need a recording of the live discussing the discussion of the cases. Okay. So that's like, you have to attend that. All right. And I recommend that you don't lazy out on this. If you're working, you only have 3 months. If you want to make the best out of it, you need to be focused. You make yourself available. Okay. Any live session that we have, make yourself available. Okay. Because you don't have a lot of time. It's going to be, it's a fast-paced thing. So Saturday, make yourself available for these sessions, and Sunday as well. And then this new one that we're going to add, which is the textbook seminar, we're going to go through the photos in the radiology textbooks and pathology textbooks to cover anything that's ACJ related, okay, for you. These will be recorded as well. Now, we're planning to put it on the Saturday, but if we find that that doesn't work, then we might switch it during the week, but they will be recorded anyway, okay? So that's for the live sessions. So you might have 3 different live sessions, but in 2 days, okay? If needed, we might expand it to 3 days. So you need to be flexible a bit with us. But anyway, that 3rd live session will be recorded. So even if you cannot make it, the only one that I know will not be recorded is the Saturday one, because we already have recordings for that, okay? What? Okay, I could leave a note. Cool. You guys could do that too. I don't want, okay. But anyway, cases and practices now. So we talked about that the specific case will be open with each module. So for example, module 3, you'll have 4 cases that will open, radio practice and radio practice 1. You should solve these cases and practice before Saturday. You will also receive a score, comparison with your colleagues, use this to learn and improve during the course. There's no timer for cases. So when it comes to cases, like we wanted to put a timer, but we find it's too soon to make you feel like a mock at this time, okay? So, you could take your time a bit with it, learn. We want you to learn from it, but also don't be too comfortable with it. Like, don't do one question and go and then do another question later. Like, try to solve each case independently. You could do one case at a time, but try to solve like each case, you're done one case, right? You only have 1 attempt for each case and each radio practice. But you'll always have access to their answers, okay? And how they like the question and the answers. Could try to show you guys how one of them looks like so that you kind of understand. So if we go see if I could find it for you. So I'm just going to and if you have any questions so far about what I've said so far, okay, not something forward yet. Let me finish, then you can ask about new things. The books will be shipped, and we will have an online platform similar to AFK. We're planning to do that as well. I know some of you like the way we did it in AFK, so we might transfer that to ACJ as well. Most likely, we're already like setting it up, so we have the intention to do it. I'm just trying to make sure I get the right link here. So people here that were in our AFK course, remember how you did the mocks? And people that were already in our ACJ course, you already kind of know how that was all done. So I'm just trying to find, I think it's, oh, there it is. Okay. Sometimes it's hard to find where it is. So if I do this, so, you know, you guys will have your, let's just put any email here. I mean, and then, so you'll have a platform like this. This is just a testing one. Okay. This is the intro case. Okay. You have it in the platform. We'll go through it there. Okay. And this is how it looked like. You'll have all the weeks here, and they only open during their week. Okay. And you go start. You're about to start. So now you have 15 minutes and you want to solve this case. Okay. So you can see you have the case, you have the question, you could answer. So if you only could answer one, or in some of them you could answer one or more, you see. And then you'll be evaluated at the end. This is our intro case, so I might go through it soon. Okay. Let me see if I go back for now so I don't start it. Okay, so let's go back to here. Okay, so that's how those tests look like. Okay. Now, course structure. So we're done with cases and practices. Course structure and plan. So as we said, phase 1, learn the templates, 2 weeks. The first 2 weeks of the course are mainly to learn the ACJ templates, watch the videos during the weekdays, and discuss your doubts on the live weekends. Phase 2, practice and solve cases. This is going to be 4 to 5 weeks. So right now, 1, 2, 3, 4. You could say this path, though, also 5 weeks. You will learn how to implement your knowledge in a case-based method. You'll have 4 cases a week and 100 extras every week in the ACJ, in an ACJ exam-like method. You'll have negative marking. And during this phase, you should not only solve cases and watch the videos, but you should also go back and review the templates, see where you made your mistakes and why, how would you have changed that. Then phase 3 is the mocks. So right now, during this cycle, we have 5 weeks. This phase, you will experience full mock exams with security monitoring, timer, using our software via link provided. And we'll teach you how this works later on when we get there, okay? Some of you that did our AFK already kind of know how it works, and people that are repeating the ACJ already know. Your first step is to become familiar with the ACJ format, so that's what we want to get started with. Okay, so if you're repeating the course, if it's the free repeat for our students, we're not shipping anything to you new, but you will have access to the online one if there's, and that one, if there's any updates, you'll see it, okay? But right now, we haven't necessarily made any significant updates to the textbook. It's more in the videos. And if there's any minor edits you want to do, just follow the videos. The cool thing about these videos, we'll show you. So now we're done with this. Okay, so look, we're done with course structure and guide. Let's look at the schedule. So you could see, just to make it familiar, this is the orientation, right? And then module 1. I don't want to highlight anymore because whenever I do that, okay. So module 1, Feb 6 to 12, watch the videos, and then Feb 11 and 12 is when you have the live. Okay, you guys see this? So all the way through until the mocks. And you could download the schedule. This is how it shows you how to download. You can even click on this and it'll download the schedule for you. Okay. It's all built in. So every time now that you don't have to kind of refer to the schedule, you just click on this whenever you want and you have the schedule with you. Okay. So the videos, we'll talk about them as well. So the first 2 weeks of videos, it's in the orientation slides. We'll go through it. But the first 2 weeks is around 15 hours for week 1 and 18 hours for week 2. Okay. Then the cases varies. So each case is usually 20 to 30 minutes. Think of it like that. So this is the older schedule, just because the plan, this is here where the main plan is, I think. So you can see 1 to 4. So we added 4 cases instead of 3. Okay. So this has changed, right? But this is in a PDF. That's why this one is editable. We could edit this live and it shows up on your end. You see? So we have to maybe change this PDF, but follow this one here right now that's live for you, right? Which is easier even. Like we might even eliminate the concept of the PDF for now. But pretty much you have 4 cases now, not 3, okay? Now we have the intro, how the ACJ works. So this is me going through this current video. The slides I was just presenting to you, right? So you could watch this and you still have the watermark. But now you could go full screen. So one new thing you have is you could go full screen and the watermark also is there. So it will change position. So we don't, allow any kind of recording. So that's part of the system. But people would like to go full screen. Now you can, right? So that's one new thing that's awesome, that you can go full screen. Of course, you have captions if you want the English captions, for example. And there's something really cool too. And also, in addition, it works on your phone and tablet. And there's one more thing that is really cool that I haven't yet did on this video because it wasn't needed, but I could communicate through the video with you guys interactively. So I could actually, if there's anything we wanted to change or do, something will pop up and actually stop the video, right? It'll stop the video and tell you, read this. You could read it, and if you click on it, it could take you to another point in the video. So those are cool things that we could interact with you live, during the course. If there's anything we want to do or change or add, we could do it through the video. And yeah, that's one thing that we're actually excited about. So this is how the ACJ course works. I'm not going to go through it. Here's the case introduction. So I'll click on a link, and then it'll take you to. So here's the solution. So I'm not going to solve the case. You guys should do the case introduction yourself. And this is the solution. So do the case introduction here, right? You go to continue, you put your info, and then you'll watch the solution. Then we're also inside the actual module, we'll actually put what live session you have so that everything is in one place. We're trying to make this as like, how do you say, convenient and seamlessly as possible. You don't have to go too many places. So it tells you, look, the live Zoom for this week is Saturday, February 4th, 9:30. And if you click on it, you could see who's giving the lecture. And here's the Zoom link for that lecture. Okay, so you just click on it and it'll take you to the Zoom link. Okay, so this is today's orientation. So each module will have maybe like a 3, if there's 3 that week, or we'll put the Zoom links as we go. Okay. Now, the difference between ACJ and AFK is that with the ACJ, each module will remain open because we understand you want to go back to see the templates and stuff. So it's important to keep them open throughout. So on Monday, module 1 will open, Feb 6, automatically, and the previous ones will be open. Now, another feature of this, of course, we can add chapters. So that's something we might work on depending. So we'll have like chapters that you could go from one point to another. And also, you could do a discussion right on the specific activity. So you can see this tab here, it says discussion, you see? So let's say you're watching this video and you're like, hey, I liked, for example, that question 3 or time 3:17. I don't agree, for example, right? And then now you could just say share. So now I made this post here and people could reply to it and interact with you about that video. Now, if I go to another video, you could see it's not there because each one has its own discussion. And I think that is awesome because you might not need to go to the forum too much anymore, but you know, this way, each thing has its own discussion, right? So whatever you're talking about, whatever activity you're talking about, it's in the discussion area and other students could see it as well, okay? So that is how the platform, our new platform is working, okay? All of these will have those. Of course, the mocks will be, when we get to the mocks, they'll be done on this platform, but not like separately, and they'll be monitored differently. We'll teach you how to do that later on. Any questions about this part so far? Okay, if there's no questions about this part, I'll go back to these slides, okay? Now, again, the slides, they're kind of, I'm repeating what is already in one of those videos. So let me see here. No. Okay, here it is. So you guys can see. So you guys can see the slides now. Okay, so we talked about, oh my goodness, okay. Let me just, there, okay. So we talked about now how the online portal looks like. Cool. Any questions about that? If no, we'll move on. So how does the ACJ work again? They will bring you a case like this. Okay. You can see you have the patient information. You have their specific kind of, you know, information, age, gender, weight, height, and then you have their vitals. Okay. You have their chief complaint and history of chief complaint, their history, dental and medical. Medical is very important. And social and family history, and then their clinical exam results. Okay, right now it's simple, none, right? So just some tips here. This is obviously not enough right now, but just kind of an idea. So age, well, it could help. All right, the age, you need to read it because it could help you in diagnosing things. Like, is it a molar stage 3? Earlier, we used to, like, you know, when we would have an aggressive periodontitis. Sorry, I'm just going to get some water. Okay. Age would help. So if you have a 27-year-old and they're having like attachment loss, then we would go with aggressive. And we still see them use that in the new classification of perio. So a lot of times they'll be younger, but they'll be stage 3C. Blood pressure. If it's very, very high, you might have to delay elective treatment, like in the Haas articles. Temperature, very important. If they have fever, that's an indication that it could be an abscess, systemic involvement, and you may need antibiotics. Allergies, if they're allergic to penicillin, then you can't give penicillin, or to sulfite, for example, then you can't give local anesthetic with epinephrine, right? So they're not gonna, it's not an AFK question where they're telling you, hey, here's a patient, here's the summary that you need. What's the answer? They're going to give you the entire case and you have to extract the summary for the question. Okay. Extraoral finding could be lymphadenopathy, swelling, for example. Okay. So now you cannot receive more than 1 mark for each question, and you cannot receive less than 0 per question. So this is what people may not understand. When I said previously, we have negative marking. I don't want to call it negative marking. Let's rephrase it. But what that means is, let's say here's a question. You can see how each option has a distribution, right? So here you have 0.3, 0.3, and 0.4. So if you answer these 3, what's your score? I mean, I'm going to start with an easy one, but If you answer these three, what's your score? Someone throw it out there. Yeah, 1. So you got 1, right? So 1 point for that question. Okay. All right. So let's do another one. Okay. I'll change the color. If you answer these 3, but you answer these 2 with it, what's your score? Are you sure? Mathematically? So mathematically, okay, so mathematically, it should be -1, but you cannot get less than 1. So your score would be 0. Yeah, so mathematically it's -1, but remember each question, the least you could get is 0. See? The NDEB is being nice, right? So, so they're not gonna, if you answer a bunch of -1s, they're not gonna keep dragging you down, okay? You could only get 0 or 1. Make sense? Now let's add another option just to kind of, let's put another color here. Let's say we use green. Let's say this one is correct and it's also 0.5, okay? Okay, so now let's say you answer this, 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 and this. What's your score? Mathematically, it should be 1.5, but you cannot get more than 1 in a question. So it'll be 1. Make sense? So the least you could get in a question is 0, right? And the most you could get is 1. Is that clear now? Okay. Okay, so instead of repeating, tell me what you're confused about. That makes it more easier. So what's the most you could get? Forget the terms. What's the most you could get for each question? What's the least you could get? How many options can you choose? As many as you want. Okay. So math works as long as it's within a range of 0 and 1. You see? Yes, go ahead. If you want to speak and ask, that's fine.
So, doctor, the thing is, either the question is right or it's wrong. Even if we choose one option and that contains like, so it's 1. Is it?
Yeah, yeah. So let's say, give me an option you want to choose here.
So, for example, it has E. So E is 3. So if I choose E, I get
It's
1.
0.3.
Okay, 0.3. Okay.
So now you get
So,
0.3 out of 1.
okay. Okay.
Okay.
It's
What's
0.3.
another example to clarify it for you?
No, it's okay. I could. It's 0.3, right? Yeah.
Yes, correct. So
okay. Sure.
yeah?
Thank you. Thank you.
Awesome. So each question will not impact another question. Does that make sense? It'll only impact its own question. So when we say negative marking, the reason I don't like that is because some people think like if you get -1 here, it could ruin another question, but no, it can't. So it's only within itself. Okay. So your range is from 0 to 1. Okay. So if you get these 2, then you get 0.6 out of 1, right? And if you get these 2 and you choose this, then you get 0 out of 1. This is why choosing a wrong answer is very bad. That's what ruins everything. Makes sense? So correct, it's either 0 or 1 or anything in between. Okay. The other thing is, you see the zeros? That means, it doesn't mean you get a 0, by the way. It just means it's neutral. Okay, so if you answer H and G, what's your score? Anyone knows? Yes, perfect. So 0.3, right? Not 0. You see? It's an addition, okay? Imagine you're just doing plus, 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 okay? It doesn't mean you get 0. It means, well, we don't want to reward you, but we're also not going to punish you because we see what you mean. It could have looked like carries, but it's not really carries. Okay. Okay. There's a comment, wish the negatives were also minus 0.30. No. So this is the thing. It's either very wrong that they don't think you should have picked it in the first place, or it's a 0. Okay. So sometimes you'll find options sometimes you could find options, let's say, that are like this, +1 and plus 0.5. Interesting, right? So if you answered this, you would have got the full mark. If you answered this, you get half the mark. But if you answer both, fine, you'll get the full mark at 1 out of 1 anyway. You see? But there's one they really want you to go for. Does that make sense? There's one that they care that you do. Okay. Another thing is that the concept is, should you chase the zeros? So our strategy is you shouldn't be chasing zeros. Okay. You shouldn't be looking for these zeros and being like, I want to answer them. No, because they could be a -1. You don't want to risk it, right? You want to make sure you choose the thing you are most likely like 100% sure is correct, right? And this is where risk management comes in. Okay. You have to manage your risk, meaning if you have, let's say you go through these options. Okay. I'm going to delete all this. Okay, let's say you go through all these options and you're like, well, I'm not going to select anything here, so I don't know which one's right. Okay, let's say you go through these options and you are suspecting, like this is what you're suspecting. Okay, you're suspecting, I think this one is right. And that's it. Well, then you should choose it, right? So that means you only have one option that you think is right, so choose it. Okay, well, I think this one is right, and I think this one is right. Okay, how much are you sure about this? Like, are you 100% sure? Are you 50-50, right? Maybe in this case, you might choose them if you're 100% sure, right? But let's say now you're like, wow, I'm 100% sure this is right. I'm 100% sure this is right. This one, I'm doubting. I'm 50-50. I don't think everybody will agree on me with this, but I think I'm catching something because, I'm special and I found this and no one else will, right? And this one here, I'm kind of 50-50 on because I don't think anyone else will agree with me. But so in this case, you have 4 options that you are doubting, you're thinking about. 2 of them are 100% you're sure, right? And another 2, you're 50-50. The wise thing to do is to select the 2 you're 100% sure about. You see? You don't want to choose something you're not 100% sure about. Okay? If you have a lot of options. So when you have a lot of good options that you're sure about, don't choose the ones that you're 50-50. Okay? But if I only have one option, right? And that option is 50-50, then I would choose it because it's my only option that I could choose. It's the best one I have. Okay. So if this is the only one I think is right and it's 50-50, then I would choose it. You see? So you have to manage your risk. Okay. We'll talk a lot more about that during the course as well. So the NDEB is using the new periodontal classification, obviously, for 2018. So that's the one we'll learn. And I'll tell you guys how to apply it. In Perio and ACJ, for those of you that are new, you'll see that, you have to learn how to read charts now. And this is the ACJ chart. So the ACJ chart, they'll give you a set of teeth like this, and they'll give you probing depth, recession, and whatnot. We'll teach you how to read it and how to decide basically the diagnosis, right? So you can see a dot here means there is bleeding on probing. Lines means it's not, that tooth is missing. Okay. And these are probing depth and recession. So you could see here from the probing depth 4 and recession 3, that means cal is 7 millimeters, right? And if you have, for example, probing depth 3, that's considered normal, right? And probing depth 4, you could say cal equals 1 here. Okay. So we'll teach you these things as well. And then it does say that this quad represents the mouth. So, you'll figure out if it's we'll teach you the classification basically, but you'll get used to reading these charts. You can see here is mobility and furcation. Now, if you look at the virtual OSCE, okay, interestingly, virtual OSCE has a new chart or a different chart. And that chart is a little bit easier actually, because they give you Cal right away. So what I told our students before they went to the ACJ exam, I said, hey, it's a good idea to look at the OSCE chart just in case they bring it, so you're familiar, not surprised. Okay, so we could send you that. But right now, we don't have evidence that they used the OSCE chart. They didn't. They still use the ACJ chart, but you know, just in case they threw in the OSCE chart. But it's easier still. It's not like it's something more difficult. But some people get stressed out when there's something new, even if it's easy. So you have to not get stressed out if there's something new and it's easy. You know, it's not an issue. Okay, so again, that's the perio chart. Endodontics, you know, never mind. This is what the NDEB has on their website. Like, and NDEB is aware of any new guidelines for antibiotics. So you could see even in AFK, they're not bringing clindamycin as treatment anymore, right? So we'll talk about, you know, different strategies and updates for that. Now, some tips about ACJ itself, other than what the NDEB will tell you, okay, and what it is. First of all, know your limits. Don't try to perfect it. You don't have to get 100%. There's no score. You don't even know what your score is, right? There's no point of getting 100%. So trying to perfect it, meaning, you know, every single option you doubt, you're like, I think this, I think things, oh, this one, this could be, this randomly selecting, you're going to lose marks now. So just go for what you're sure about and leave the doubts alone, okay? So you don't need to perfect it. And it relies on judgment. It's called a judgment exam, right? So a saying here by Galileo is, you cannot teach a person anything. You could only help them find it within himself or herself. So we have to bring out the critical judgment thinking dentist in you. We can't just tell you memorize, because you're going to get a curveball in the exam. It's judgment. One thing, like one time, a leukoplakia treatment may make sense in one way, but then another time it may make sense in a different way, right? If you get lichen planus, treatment of it may be one way, but then, hey, for this patient, I may want to do this, depending on the case and how they make you feel about the case, right? So you have to use your judgment, but you learn the protocols, but then you have to learn how to, you know, use your judgment in the exam. So we want to bring that judgment out from you, right? We want to get you there. And the best way is to help you practice on your own, make decisions during the week, solving the cases, and then talking about it at the end. So some tips before you start, well, these could be applied in the third week. So read the case carefully once at the beginning and review it after reading every question. So a lot of times you forget what's in the case, and you'll learn this from practice. You'll see. I tell people they don't believe it, then they'll learn. I say, look, did you go back to the case? Look what it says. They're allergic to NSAID. You didn't see that. Why didn't you go back to the case after you solved the first question, the second, the third? You forgot the case sometimes, right? By the third question. Sometimes it helps reading the question first, even. If you jump to the question and see what are they going to ask me about, and then I'll go check the case. Or read the case, the question, then back to the case. Okay? So just because it says one or more in some questions doesn't mean you have to answer one or more. Some people, like, when they see the one or more, they're like, they got to be another one. No, maybe it's just one answer, right? So be satisfied with one or two. So first thing you want to do is look for one very correct answer that you just love. Like, that's going to be your backbone, okay, for that question. I just need one that's awesome. That's 100% right. Okay. Now, once you found that one that you love, only answer more options if they are as very correct as the one you found. Okay? You found one that's very correct. You're like, this has to be the answer. No one could argue me. Am I going to add another answer? Only answer a second one and a third one if those are equally strong. Okay? Don't choose answers using the logic of why not. Many American students that come here and do their OSCEs, that's what they do. They look at the ACJ template or the OSCE template and they go like, oh, this person has hyperocclusion, let's say. Oh, why not? We'll reduce some of the occlusion. We'll give them NSAID, possibly we'll do this too, and we'll make him even night guard. Like, they just start answering because why not? They're do this and do this. They all could. No, it's not a why not exam. It's why are you doing this? Okay. So use the logic of course, this is an answer. We have to do this. Not the logic of why not do this. Why not do this? Do it. No, this is an answer. This we have to do. Okay. And you have to work on getting the select only one answer questions correct. Those are the most valuable questions because you could either get 0 or 1. There's no in between because there's only one answer. So one of the options is going to have 100% on it. You see, it's going to have 100% of the mark because you can only select one. And those are usually pathology photos and sometimes x-rays. Okay. And x-ray pathology. So it's very important to get those ones right. That's why radiology and pathology will help you a lot. Okay. And those are the things we're going to add as a live session, only pathology and radiology textbooks in the new seminar sessions. So what are the topics? As we said, in clinical, you have investigation, patient management, oral pathology, perio, endo, pharma. Pharma is in a weird way where you kind of have to read a prescription and then see what's wrong with it. Local anesthesia, medical emergencies, and ortho. So ortho, I you just want to know the basics. From some students, they said, oh, the one in the exam was kind of straightforward. I heard another student that passed that said it wasn't so straightforward. So it depends on how you are with ortho. But our strategy is don't go too deep in ortho. It's very subjective. You might end up, over studying it and neglecting radiology, right? Which is more important, and pathology. So focus mostly on pathology, radiology, ortho, just get your basics and get out. And the basics themselves, some people have debates about them. So don't care too much about it. Okay. Well, of course, we'll teach you it. We'll run you through it, but get your basics only. Okay. But these we want to focus on a lot. Okay. So normal anatomy, caries, calculus, teeth abnormalities, pathologies and lesions, endo evaluation, what complicates an endodontic treatment and exo, and other stuff. So radiology, very important. And obviously the clinical stuff are important as well. Now, what are you learning? Are you learning knowledge? If I ask anyone here, you mostly all passed AFK. What's the treatment of lichen planus? Does anyone know? Oral lichen planus. What's the treatment of that? Let's say there is, could be leave it could be topical steroid, right? So you know the knowledge, you see? But interestingly, the ACJ question is not, hello, doctor, what is the treatment of lichen planus? That's not the ACJ question. The ACJ question is a patient comes in, not even that. It's just, here's a case history of a patient. And here's a photo, here's a question. What do? You see? So it's really, you know the knowledge, but now it's really stopping yourself from over answering. The ACJ mostly is about how to stop yourself from answering incorrectly. Because I think you all get the right answers, but it's stopping yourself from answering the wrong ones. You see? And that's a habit. So what I found out is that ACJ is a habit building kind of thing. You want to build good habits. This is why it's so important, I found, that we can't just have a case and discuss it. It's not as valuable as actually putting you in an exam environment. So every week, you're going to get 4 cases and 100 x-rays, and you have to make decisions. It's not just me showing you an x-ray and talking about it, and you just passively learning. No, it's you have to make a decision on that x-ray so that you build the habit. You get my point? So you have to build the right habits so that you could carry those on to the exam. Because you could learn the knowledge, you could learn from me, and from all the instructors here. But in the exam, you might be stressed out, and then your bad habits come out, and you're like, yeah, why not this and why not that? And so that's why it's important. So how are we gonna? What's our strategy for the topics? Investigation, patient management, periodontics, endo, pharma, local anesthesia, medical emergencies. These topics, right? Look, I didn't put patho here or radio. Learn and study. So you learn how to do periodiagnosis, treatment, medical emergencies. You learn them, you study them, you memorize the treatments. Each case is a little bit different. You have to analyze the case actually. They need thinking. Think of it like that. They're more of a thinking thing. You learn the basics, the foundation, but you still have to think in the case and be wise. right? They might tell you specifically this patient doesn't want treatment, so you have to figure out what to do, right? So you're going to have to use your knowledge and your thinking, your judgment to answer. And some things may require memorization, like emergencies, medical emergency, you have to memorize. What do you give someone that's having a myocardial infarction? Does anyone know? Okay, that's one thing. Aspirin, oxygen. Well, see, there's a good one, morphine, but you don't actually give morphine, right? So I wouldn't, it's not even in the template, but nitroglycerine. Call 911, that's good, right? You may put head tilt chin lift, possibly. Okay, so you see, you know the knowledge, you all agree. Now, what if in the case the patient is allergic to NSAID? Oh, interesting. You see what I mean by use knowledge, but you have to be smart and use your judgment and read the case. So now you would answer to the same, but you're like, wait, I can't just memorize. I can't just memorize like I'm not a dentist and I just want to just, you're a dentist, you have to think. You have to have that judgment. Okay. So you go and you don't choose aspirin then, right? Because they're allergic. So you have to think. That's why I'm saying you can't memorize everything. You have to use your thinking. Okay. Some students said that in the previous exam they got bad quality of radiographs. I didn't hear that from my students. So, you know, I think people might just be complaining, but it doesn't matter. If it's bad quality, it's bad quality for everybody, right? So it's equal, still equal. It's not like one person got it and one person didn't. Okay. Do they bring CBCT, like an actual X-ray of a CBCT? No. Because CBCT is not an X-ray, right? CBCT is you could actually walk 3D through all the planes. So how are they going to bring that in a 2D exam, right? They're not going to actually give you a software to work on, right? So no, it's not like a requirement. Now, so you guys understand how you are studying these topics, right? Knowledge and judgment. Okay, what about ortho and endo X-ray evaluation? These study lightly. Okay, a lot of people went to some endo books and they're like, you know what? At the end, I felt it was a waste of time. You know, they talk a lot about endo, but it's not the stuff that comes, right? Most of the X-rays for endo were underfilled. Like you're going to get basic stuff. So don't overthink it with ortho and endo. Just study the basics, be conservative. In ortho and endo, if you find one good answer, be content. Okay. So I see underfilled, I'll pick it. If other things I'm doubting, I might not pick it. That's it. Ortho is subjective. So they also remove few templates. So you'll come out from the exam, someone will be like, hey, it was a class 1, another person will be a class 2, and they'll both be orthodontists probably, you know. So just learn the foundation and go and your make sure your other stuff is good, especially your radiology. Now, patho and radiology, be able to recognize based on repetition and practice. That's why we're going to add these seminars. Okay. These seminars every week where you're going to go through photos and textbooks with our instructor. And she did it herself for her exam and she made it through. You're going to do. So how do you do patho and radio? It's not necessarily a learn and study. It's more of recognition and repetition. It's different than perio and other ones. Okay. Recognizing pathologies in a photo and radiology carries, for example, and pathologies and radiographs is like recognizing people faces. You don't memorize my face by thinking about his eyes are this many millimeters apart, his nose is circular, and his mouth. You know what I mean? What do? You look at it multiple times and you go like, oh, I know that person. Does that make sense? That's how you have to become with patho and radio. You have patho, you see a mucocele, you don't need to, oh, a mucocele looks a little bit bluish. Oh yeah, that's the definition. No, you have to go, oh, I know that's a mucocele. That's how they look like. You know? And then then you use that to create your differential, and then maybe you use some knowledge to differentiate between the two if there's a differential. Does that make sense? So people sometimes they study like they don't know these things. So this is why I'm saying pathology, radiology, you have to keep seeing until you get used to it. And then with that, you will recognize, oh, this is an ISDA class, for example, RA5. This is an RB5 or RC5, sorry. This is an RA2 now, I think. So, and I show our students tools that I use to do that in the beginning, but eventually you kind of get there on your own, right? So these require time and experience, which is why you have to start from the beginning with them, and we'll do weekly seminars about these. So it's not a memorizing thing sometimes. It's a repetition and recognition, okay? So even this Feb. Yeah, so I'm hearing what you're saying from you. There's a comment about what was the exam content in AFK, but the concept is I don't take those a lot because everybody will show their experiences, you know? But yeah, possibly they'll change it up. You can't rely on anything. They'll change it up next time, maybe, right? So now, how long would ACJ preparation take? Well, some could do it in one cycle, but others need 2 cycles. This is the reality. So we have a 3 months training program. Then the exam comes. Some may be ready, some may not. Depends on where you started, right? How is your judgment now? Some of you are already good in this kind of stuff. You know, you're already good in thinking about how to judge these things. Some of you are very AFK thinking, like you need a question to be able to answer. You don't know how to answer this way. It might take you longer, okay? So this depends on your starting point. Make sense? And it's how fast you could improve and change your habits. Some people, like I tell them something once, next time they figured it out. Some people keep making the same mistake. Like I knew a person I think it was maybe 10 years ago actually, but I knew this person that was stuck in ACJ. They had issues with it. They were stuck in it, right? So everybody's different. That's why I'm saying it's like, it's not about just the course. We're not a cookie factory that you come in, you come out like, you know, the same. You come in, you come out better. But is it enough for you to pass? It depends on each person where they started, right? So how long, and I encourage that you take these courses seriously so you don't need to repeat too much the exam. What do I mean? Don't go working full time and doing this course and not like, take it seriously. Study, go through all the live sessions, go study look at photos. We can't bring you all the photos in the world in a course. That doesn't make sense. We'll just be here all the time just looking at photos. We'll give you a case, we'll give you a guidance, but it's encouraged that you go open and look at photos of pathologies from a reliable textbook and photos of radiology from a reliable textbook. Don't use Google image unless you know how to use it, because if you go to Google and you type something in images, they sometimes bring you an image that's close enough and it's probably wrong. You have to make sure you read what the name is and it's from a good authority. So it's all about building the right habits, and habits take time. We will review the plan at the end again. So I think we already talked about this. So I don't know why it's repeating. Okay, so we're just kind of, I just need a 1 minute break or 2 minutes. I'll be back. Oh, give me a sec. We'll be almost done. Okay, back. Sorry about that. So back to the patient history. We were saying, yeah. So again, how to analyze a patient history? Like we talked, patient information, age, gender, weight, height. The blood pressure normal should be this, right? Pulse rate is this. Respiration rate is this. Memorize these. Sometimes I see it, I think like this. Sometimes, wait, should be like this, I think. And then temperature. Okay. So review the history with every question. Consider the option of reading the question first. So you start backwards. Read history quickly, read question, check history again. That's a good way. So sometimes they might tell you so the most important ones here I find is like usually blood pressure and the temperature. But the temperature is for fever and diagnosing, because if you have like a viral infection or bacterial infection, and blood pressure is for like if you need to delay or not delay treatment. These help in a way where sometimes they compare it. So if they give you a medical emergency question, they might say, well, the patient's pulse now is like 40. Then you could go, oh, wait, their heartbeat went down, right? For example. So just comparing to the base. Then you have the chief complaint history, dental history, medical history. As we said, we went kind of through these a bit, but we'll learn how to use them during the course. In medical history, like they could give you diabetes, hypertension, and these may play a role in your patient management and treatment options. Okay. In medical history, also there's current medications. So they might tell you they're going to tell you the drug names. So again, all our AFK students, you're going to be good with this because you kind of could refer it back to know what it is. Like if you have a sartan, you understand, okay, that's a blood pressure thing. April, right? Or a statin, which is for hyperlipidemia or cholesterol, right? If you have propanolol, you kind of know what that is, metformin. So that helps you like recognize what they're taking, even though they should tell you in their medical history what they have. So if they have diabetes and they're taking metformin, like it shouldn't be that they're taking metformin and they don't mention they have diabetes, right? You're already going to know what disease they have, but knowing what drug they're taking may influence some of your decisions. Like for example, if they're taking lithium and then you contraindicate, NSAIDs or something like that, right? Allergies are very important, of course. Penicillin, codeine, sulfite, latex. These are the most common, like important ones that you'll see. Okay, so week 1 is, so I kind of showed you guys already the plan within the platform, right? So week 1 is around 15 hours of videos, and week 2 is 18 hours of videos. So if you do 4 hours, every day, you should be good until the Saturday. And then Saturday you do the live, right? That's for the first 2 weeks. So that's pretty much it. And we're starting Monday. So you won't be getting obviously the book in a day, but you'll have access to the online one and you could take notes there until the end of the course, and then it'll go away. But you could transfer those notes later on to your textbook. Okay. So I think we are done with the orientation part. And I'm kind of I could still share this part with you guys if you are interested, to see if you have any questions about this platform and how it would work. Okay, so let me know if you guys have any questions. So I have a private question here about the seats and the seat situation with the ACJ exam. So these are things that we cannot like know for sure. Okay, now we know that the seats got fully booked for the May exam, correct? That's it, they're booked. So that's what you have to assume for now. Okay. Okay. So you have 2 options, right? I'll answer this question, then I'll go to your question, Himani, but let me just you have 2 options and you have to decide what's best. I could tell you what's best, but you might not be convinced, right? So right now you're here, you're in Feb of 2023. you have Feb, March, April, May. This is where the exam is, ACJ. Then you have June, July, August, September, October, November. Here's the next ACJ. Okay. And then you have our course starts in September. We actually, it depends on when it is in November. We might have to start in August, but basically our course will start somewhere here. So there's two options. You either say, hey, I'm going to use the mentality of I'm not going to take a course until I guarantee my seat, which is usually not a good strategy. Okay. But you could do that. So what you're going to do is you're going to not take anything from all the way here to here, lose 6 months. Maybe here, hopefully you hope to get in. Then you get in and you start a course. That's one strategy. The other strategy is say, hey, I'm taking this ACJ, whether it's today or next month, next year or the year after I'm taking it. It's better to be prepared. And when I do get a seat, I want to be ready as much as I can. So you could start preparing with the course. And now you have this gap to read on your own, right? And continue learning. And then you could say, hey, let me see if I can get into the exam. And then you could either do your free repeat or just, continue depends on what we're doing there. So I can't guarantee we're doing a free repeat there for non-AFK students. But what I'm saying is you start now, you read, and then when you get in, you could either do a repeat or not. So it depends there, right? So which one would you rather be? Most of the people I consult on the team is the early starting strategy, that you should start early so that you don't know, maybe they do open it and then you got lucky and you got in. You want to be ready. You don't want to lose an attempt. Even if you got into the November, it's better to have these two preparation phases so that you're ready more for a November exam instead of having 3 months. It'll increase your chance of passing. So for this cycle, Feb 2023, we're still doing the free repeat for next. Okay. So now you have to decide what's best. There's no answer here, right? There's no answer because I'm going to tell you an answer. I'm going to say, no, start preparing, take the course. Then when you get in, you could start, when you get to the exam, you're ready and you could do another cycle of the course, right? And if you do that here, you're going to get a free repeat. But you might be like, no, I want to get in first. So you have to decide. I can't decide for you, right? That's my strategy. The next one is, when we go to week 2, will week 1 be closed? No. So in ACJ, the weeks don't close. Okay. So you'll always have them open for you to go back and check them up. Okay. Check them out. All right. Answer the question, Himani. So it's unlike AFK, because AFK, it's like there's a new thing every week. In ACJ, it's different. You have the first 2 weeks are something which are the templates that I want you to keep going back to. And then you have the cases going on every week, right? So it's a little bit different. Okay, does that answer your question? So even if you come in a week late into ACJ, you still have access to the previous things. Make sense? Okay. Yep, go ahead, Mohammed.
Yeah, hi, doctor.
Hey.
So I want to ask you, if I took now the course,
Yeah,
we'll get the free repeat, but I can take the free repeat when I make sure I have a seat. Like, for example, maybe not the second cycle, the one after, or
I mean, I don't know if we'll be infinite, but yeah, let's say you took the course now and then you're in November, you couldn't get a seat. And you want to, let's say, regardless of the seat, let's say you took the course now and then you don't want to do your free repeat next time, you want to do the one after, that's fine.
Usually the seats are harder than the AFK. So to
Not
get
usually, just this time it was, yeah. It was kind of just weird like that, but it's not like the usual,
So how hard was it? In a few minutes, everything was.
Yeah. It was pretty much like that.
Okay.
Yeah.
And,
So-
for AFK, like you told us, it was like you had like 90% passing rate there. Is it here close or?
So as I said, above 75, it was around 60%. People that got above 75 in their mocks, 60% of those passed.
Okay.
Like 57 to 60, right? So it's a little bit harder, but now we're also implementing something new, which is going through the textbooks, right? And that's what the people that passed did. I looked at the factors that, well, what's the difference between these and these? I found that some people went through the images in textbooks, like the radiology textbooks and the pathology textbooks, not going through the theory, just looking at the photos and reading underneath. So we're going to do that for you. We're going to take you through that.
Okay, perfect. So I contact them to start the course with the add-on.
Sorry?
I contact Fardan. I'm waiting just
Oh
to
yeah,
see.
so we could I'll send the I forgot to do that. I'll send the registration link in the chat, and anyone who's interested can go through it. No worries.
Okay, thank you.
Okay, so here is the link to the course, everybody. Registration. Once you go through this, you could do the full payment or you could do the installment plan. Once you go through it, we'll start printing and shipping, and you'll get access to our WhatsApp group that we have. We also have a WhatsApp group for ACJ, and also to the platform. You'll get your email, and you'll create your password and get in. And you start the introduction, and Monday you'll start module 1 templates, part 1. Hi, Dr. Ahmad. So are there going to be books for us to refer to just like AFK? Yes, there's one ACJ book. We'll send it to you, but that's all you need. And then we're gonna recommend some textbooks, but we're gonna also walk you through them in some live sessions. Okay. Like we have a good selection of instructors. Like one instructor is in UFT, so you're going to pick his brain to learn about the UFT concepts. One instructor did the ACJ on her own through textbooks, so she's going to walk you through those parts. Another instructor also passed with a good score back when they were giving scores, and has done multiple like local courses, so you'll have the knowledge from him according to like what's going on in the community too. So you have different, and then you have me doing the videos mainly, and also like I'll be like in some sessions, but the mixture is going to be, I think, very awesome. Dr. Hajar doesn't like she's more of an AFK. Yeah, Dr. Hajar is more of AFK. So trust me, I only will select instructors that have knowledge better even than me about the topics. Okay, so or more like you could say, but also you'll see me on all the videos, and also I'll be in some of the lives. So we're a different panel, because I don't want you only to be exposed to my concepts. I think others have things to offer that I don't, and that's important too. So you're gonna see. I would say you'll see the instructors, and you could see once you get to this part, you'll know which live session is done by which instructor. Dr. Hajar, though, I tried to get her into ACJ, but she can't. She doesn't. She's not into ACJ as much. She feels she's more of an AFK kind of teacher, so that's fine. But yeah, but you'll have like really good instructors in ACJ as well. Okay. Is it a good strategy to do this Feb course for the May ACJ? Well, that's obviously, because the May ACJ, this course is made for the May ACJ, or do this course and try to get a seat later. Both work, right? Both work. When I do consults with people regarding AFK, I say starting early is a better plan than not starting, unless you don't want to finish the NDEB process. Like if that's like if you're on the fence about the NDEB process and you're like, you know, I want to do it, but I also have this other business I'm running that I'm happy with, then, you know, then you're not sure, then that's fine. I can't help you that much there. But if you're someone that's like, no, this is my main goal, what's the point of delaying? It doesn't make sense. Like, what are you delaying for? What if the door opens and they're like, whoa, the door opened, I'm not ready. So if this is your main thing, preparing is always the better decision than not preparing. Whenever you get the seat, you see, at least if you do the first initial course, you will get an idea of what it is. You know now how to guide yourself. You see, you understand what you're up against. Some people may need more time too. You don't know if you're one of those. I appreciate how you changed our thinking perspective while I was answering AFK. At a point, I started talking like you in the exam. That's great. Awesome. So hopefully you'll get that brainwashing in the videos a bit where you could go and start thinking the same way as well. For ACJ, we don't have a limit. So not necessarily a limit. It's just more of that's in situational judgment and skills where we have a limit. But in ACJ, it's not an interview-based exam. So it's open. The platform could accommodate. It's just better to get it done early, like so you don't miss out on the weeks. It's a 3-month course and has an end date, right? So once that date is end, you won't have access anymore unless you register again or you had a free repeat to do. Okay. And for our AFK students, okay, so whoever is here that just did the AFK, because I promised I would, you know, share something about what your strategies could be, okay? And if there's any other questions, you could ask, no worries. Where's this here? Clear. So for our AFK students, unfortunately, everything's happening more fast now for you. So you just did AFK in Feb, right? Feb 2023. Most likely, if we go to March, April, May, this is the exam date. I mean, you're not going to make May for sure. Like it's going to take, you're probably going to get your results in April. Okay. You're going to get your results in April. So, but you're going to be preparing for November, right? So May, June, July, August, September, October, November. So what you want to do is you could take this ACJ, go, not take this, and then here you read on your own until the next course. You get your free repeat, and then that way you did it twice for the price of one course, and you'll try to get the exam in November, right? So that's hopefully what you want to try. So for my AFK students, you're guaranteed not to get a seat in May almost, right? We know that, but you could prepare twice for the price of one instead of wasting time. The only thing is the question of what if I fail, right? So we gave you guys the evaluation test, so you know your chances. This is something that we have to split the risk in a way. So if you are worried that you're going to fail, you have two options. Either you continue ACJ, right? You're just like, hey, you know what? I'll continue studying it to prepare. Maybe some people think it helps them with AFK a bit. And you may just do your AFK on your own now because you already have the things you need. You can come back for mocks. Or we could transfer you to AFK. And that will replace your ACJ. So if you start your ACJ and your results come out here and you fail, we could transfer you to AFK with that amount. And then you will have to re-register for the ACJ later on. Or you could continue your ACJ. Obviously, if you pass, the plan is going to plan, right? That I think is what we could offer you to make it a little bit easier for you to decide to do it. So it's kind of how much you believe in yourself if you're passing. And also, it's not like we're locking you into the ACJ if you fail, okay? If it is your third attempt and you're not doing the AFK at all after this, then we could talk something differently. But this is pretty much the general strategy. Okay. Your other option is you could wait for the result. Okay. And then if you pass, you register, but you'll only get like a month of the ACJ and you'll get the book. You could do a little bit of light reading on your own, then come into the next free repeat. So even if you take 1 week, it counts as a course. So I find it doesn't make sense. I think the most thing that makes sense is either to wait and just either take the Feb course and do the free repeat or transfer, or maybe delay everything. But actually, this could be also like a midway. So this is why I can't tell you what you want. You have to decide. I could tell you the options. Make sense? Okay. Any questions about that for my AFK students? Okay. Who here is already registered again? The orientation pretty much is done. Go through that initial introduction videos and reading material, and then Feb 6, you'll get access to the next one. Okay, so you're pretty much done unless you have a question here. All right, so go through those. Are you in? Is everything working smoothly? You put in your password and you got access to all that stuff? Himani? And Ramnik as well? Awesome. Ramnik, you took AFK, right? Or with us? Or were you? Okay, cleared from before? Oh, no, you did it. Are you new to our platform in general? Okay, so you can't really compare the older platform to this platform. So I'm gonna stop the
Yeah, sorry, I'll just
Yeah.
unmute it. It was a discussion going on the chat.
Yeah.
I just cleared my AFK in October. The results came in October. So I just registered for this ACJ and I'm new to the platform and I'm liking it, really liking it.
Okay, awesome.
Very organized. Thank you.
Thank you. That's great. Because it's still we're implementing it new, so we're trying to see like what the feedback is. I want to hear also the people that did something with us and comparing it to see how big the improvement. But I'm glad that even you're finding it very nice, even that you don't know what we were doing before. That's awesome too. Good feedback.